Thank you for reading our abstract and listening to our presentation. I am Lorraine Fernandez, IFHEMA President 2019 to 2022, and joining me today are abstract co-authors Mujib Kandi from Qatar and Dorinda Sattler from the United States. IFHEMA has been a federation for 53 years, having celebrated our golden anniversary in 2019 at our 19th Congress in Dubai. IFHEMA has been an EMEA partner for over a decade. IFHEMA is the global voice of the health information management profession, and our vision, a healthy world enabled by quality health information, nicely matches to the MedInfo theme, One World, One Health. IFHEMA is particularly proud of our long-established relationship with the World Health Organization, and you will hear our President-elect, Vicky Bennett from Australia, speak with Dr. Robert Jakob in one of the EMEA plenary sessions this week. IFHEMA members have official voice and vote on several WHO Family of International Classifications committees, including Education and Training, the Morbidity Reference Group, and the Informatics, Terminology, and Classifications groups. IFHEMA members from around the globe have chaired these committees over the past decade. So if you're not familiar with IFHEMA, we're organized according to the 6 WHO regions. What you see on this slide in red represents the board members and the countries that they are from. Currently, we have 23 member nations. In keeping with IFHEMA's mission, vision, and values, we wrote a white paper in 2019 addressing the importance of managing privacy in our global world. This initiative involved our global members from 8 IFHEMA nations, and we issued an update to this white paper in September of 2020. In particular, the white paper focuses on transformation of health data from a paper-based world to a digital format. The white paper importantly includes an extensive list of references and an appendix that includes protection laws and acts from select nations, including developing nations around the world, as well as 5 global case studies. The table of contents, as you see here, and again is written by 8 different members from around the world, focuses on transformation, privacy as a global perspective, which Mujib is going to talk about more, why privacy now, and some of the surveys we conducted as a part of this white paper and the education and training that we've done since then. So let me turn it over to Mujib to talk more.
You might ask why there is such a heightened sense of importance to the healthcare privacy. First, the rapid digitization is creating an explosion in the volume of data, and they are created in many different mediums. The locations where data is stored are also expanding. While there are benefits such as easier access by multiple individuals to provide care and to perform public health activities, there are also risks associated with such a change. Second, the data and individuals move from institutions, regions, and countries, adding to the challenge of keeping the health information private within and across the boundaries. As a result, regulations are now reaching beyond the borders, such as the GDPR applies to European citizens who often live around the world. Thus, almost any organization could find themselves at legal or financial risk if they are not complying with the GDPR. The transformation of paper-based data to digital has brought about many regulations to support privacy. Privacy awareness has dramatically increased in the past decade to data sharing because of the data sharing in healthcare and supporting industries. Thus, data no longer remains in the silos or application where they are originally created. To respond, a myriad of regulations has been now created over time throughout the globe, like the Caldicott Principles from 1990s, FIPS from the 1970s are the forebearers of many of the regulations which you can see here. Some 20 years later, HIPAA from the United States targeted personally identifiable health information. In the past few years, we have seen that GDPR from the Europe, LGPD from Brazil, and the CCPA from California focused on consumer information. But these regulations also have healthcare implications. These type of regulations are expected to multiply across the globe. At the Dubai 2019 IFHIMA Congress, an IFHIMA committee was convened to conduct a privacy workshop for the developing nations. To prepare, we surveyed IFHIMA members to gather their perspectives about the state of privacy laws in the nations. We had 79 responses from 13 different countries. Here you can see the responses to the question about the state of privacy in the respondents' countries. In total, 65% of respondents indicated that laws existed in their country. However, we found it of great interest that there were differences in the perspectives, even within the same country, regarding the implementation of privacy laws. For instance, from one country, there was great variation in answers regarding the degree to which privacy laws were implemented. The answers ranged from non-existent to not fully implemented to fully implemented. The bottom line is that their perception of progress can differ enormously, thus illustrating the importance of education that we discussed. Another question that we put forward in our survey was perceived barriers to privacy. Nearly every country cited the lack of education as a barrier to ensuring healthcare privacy. During the workshop at the Dubai Congress, we encouraged the attendees to get out there and educate formally and informally within their organizations, and not to forget the importance of educating the patients and providers in all aspects of the healthcare system. Calling attention to the gaps with the supporting information is also key to addressing and implementing privacy. Ultimately, these findings highlight that the implementation and operationalization of privacy is not easy, especially within the explosion of technology that provides for the acquisition, storage, and sharing of information with a mere click of a mouse. Over to you, Dorinda.
Thank you, Mujib. Given the global pandemic we are still fighting, we certainly know that emerging trends can explode on almost a moment's notice. Nevertheless, we must prepare and manage the trends to the best of our ability. In the pandemic, we've seen telehealth and contact tracing apps proliferate, yet that does not mean we abandon the importance of managing the privacy of health information. In fact, IFHIMA wrote an article about managing privacy of health data during the pandemic. So please visit our website to read our perspectives. Regardless of the pace of emerging trends, here are 6 key steps that health informatics and health information management professionals should address in prioritizing and managing the privacy of healthcare data. First, get involved. Comment on proposed legislation. Familiarize yourself with your organization's privacy policies and practices where health information is collected, stored, used, or disclosed. Speak up in your organization. Second, assess what the proposed or enacted regulations mean for your organizations or for you as a patient or consumer. Third, communicate to your team, leadership, and legislative bodies. Fourth, identify required changes to systems, processes, and technologies based on your assessments and application of your expertise. Again, communicate these to your organization. Fifth, train. Train your organization's teams, administrators, and patients about privacy and responsibilities. And lastly, commit to continuing to learn and grow by doing what you are doing right now, which is getting continuing education. Follow government and healthcare professional association news releases and offer comment. Seek out leadership opportunities in your organization, professional association, or community. Healthcare is such a dynamic field with professionals creating and using data for diverse reasons. IFHEMA strives to stay abreast of change and educate our membership through our website, our triennial global news, and on LinkedIn. Please stay in touch with us through some of the links noted on this page. You will note this slide introduces actions for ICD-11, which we are addressing in a plenary session, as we mentioned earlier. Thank you for your interest in privacy and listening to our abstract summary. We hope that together, IFHEMA and IMEA, as long-established partners, can create one world, one health that embraces healthcare privacy. Thank you.